Hello, listeners. This is Yukta speaking, your host of today's episode, which is the talk given by Rohit Ghosh, founding member of Qure.ai, on the topic AI is making healthcare accessible and equitable. This talk is a part of the 9th IC Innovator Club meeting, hosted on the topic how technology will transform healthcare in the next 20 years. Let us hear from Rohit Ghosh.
Hi everyone, good evening. This is Rohit here. I'm one of the founding members of Qure.ai, and today's session is primarily about. I was asked to talk about what does healthcare look like in 20 years, right, and what sort of role innovation and technology plays in that. And I thought artificial intelligence is obviously something that is something I've been working on since last 5 years, and thought it might be a very interesting perspective to show what is actually happening in different parts of the world as of today, to give you an aspect of what could possibly be there in the next 20 years. That would sort of give you just a glimpse of what could be potentially possible at a much larger scale. So I have a couple of slides. I'll walk you through some of that. But the idea, again, as I said, is primarily just to sort of give you an overall idea of some of the stories that I have. So this is not a slide as much about Cure and what we have been doing, but more about some of the very interesting stories of how healthcare is already getting changed in different parts of the world, and even in the most unlikely of places that is happening. And then that would sort of be able to give you a much better idea of possibly what it looks like in 20 years. So that's the agenda. I'll just sort of give you a brief overview of Cure so that you understand what we have been working on, what innovations we have been trying to bring into the space, and then we'll jump into some of those interesting stories. That's the most interesting part for me. So about us, I think we started almost 5 years back, primarily building AIs for medical imaging solutions like X-rays, CT scans, ultrasounds. Um, all the solutions are FDA CE approved. They're focusing on 9 different disease areas. Today, we are deployed almost across 46 different countries and processing somewhere close to around 200 million images globally. So definitely a lot of experience in deploying and bringing some of these innovations into real life practice, into real life healthcare across the globe. And in terms of the work that we specifically do, I think there are three major AI solutions that we have been bringing to the space. One is an AI, the other is AI for chest CTs, the other is for AI for chest X-rays. So this, all these solutions can look at a CT or a head CT or a chest CT or a chest X-ray, can identify all the major findings from those imaging modalities completely automatically within almost 20 seconds or so, and at a fairly high, much higher degree of accuracy as compared to human readers. I'll come to some of those interesting bits slowly. And this is the footprint, I think, as I mentioned, almost 45 plus countries, almost close to, I think, close to 500 sites, I think, as we speak right now, almost close to 10,000 plus lives that we touch on a daily basis. So that's just about Cure. Quickly jumping onto some of the very interesting stories. This is my most favorite part of the story. So this would give you a glimpse of, rather than me telling you what could possibly healthcare look like and leaving it up to your imagination, I thought maybe just can help you imagine better given some of the very interesting stories that are happening, right? So the proof of the pudding lies in the eating, right? So let's jump onto the stories. So this is a story of teleradiology groups in Southeast Asia. We're using the chest X-ray solution for primarily separating all the normal chest X-rays from abnormal chest X-rays. Almost 40% of the chest X-rays that are processed by the AI are completely termed as normal chest X-rays, and those did not even looked at by a human leaders. Now, you might ask, why is that such a phenomenal change? Is that even an impactful thing, right? Chest X-rays almost take around 80% of the chest X-rays are completely normal chest X-rays in any setting almost, right? And in that kind of a setting, where chest X-rays is the most commonly used imaging methodology across the globe, you take X-rays left, right, and center for everything and anything across the sun. So in that kind of a scenario where you have so many X-rays lying around and no one wants to read them, most of these X-rays lie completely unreported in most of the hospitals for a very long period of time. Whereas X-rays is the most primary and the first method of screening in any disease or diagnosis zone, right? So in that kind of a setting, if you're having these X-rays unread for so long a time, there's definitely so much of room for improvement where AI is able to now bring it to the place. And imagine if we're able to read all these X-rays and able to identify a screen for those early signs of tuberculosis, lung cancer, COVID-19, heart failure, all this on the chest X-ray, and we are able to catch hold of the patient while the patient is at the hospital, that is real change. That is where healthcare is going to be. It is already going towards, and this is, as I said, this is just one of the starting areas where all these abnormal X-rays, which are found as abnormal by the AI, are read by the radiologist then and there. Now, this is an interesting story from Kota in Baran in Rajasthan, where all you see in the picture is people who are lying up in a primary healthcare facility in Baran near Kota, where all these people are lining up for tuberculosis screening. So TB is obviously a big disease in India. And for TB, the major challenge is all these are daily wage earners. So if they come to a screening center like this and they have to again come 2 days later for a sputum collection, that means they're losing wage, right? That's a daily earning for them. And that's why you don't have normally these patients turn up after 2-3 days for sputum collection at most of these healthcare facilities. Now, when we deployed AI, the magic was that now you can actually see within 20 seconds whether the patient is TB presumptive or not, right? And if it's TB presumptive, you catch hold of the patient, do a sputum collection then and there, and then within an hour or so, you can actually get to a TB diagnosis, right? Within a day, you do that. You don't need to ask the patient to come back. The patient is not losing their daily earning, and that's why you have a lot more patient follow-ups. So very interesting that normally you expect AI to sort of be the most impactful some of the developed countries, as you would call them, right? Some places where healthcare infrastructure is really well integrated. You think AI would possibly be the most effective there. But contrary to that popular opinion, having deployed AI in almost 46 countries, we know that AI is actually playing a much bigger and much impactful role in some of the other different areas very possibly don't even impact it. So we found that not only is AI able to reduce turnaround times, but it's also detecting more number of TB cases, right? Because a lot of these AI algorithms are actually way more accurate than human readers. Human readers normally in some of these areas, remote areas, miss out on a lot of these TB cases. We have been able to detect 33% more TB cases just in this particular deployment. When COVID happened, that was a very interesting story. So we were already working with the Municipal Corporation of Mumbai, the BMC. And with them, we had been working on tuberculosis eradication in Mumbai. And COVID happened, that presented a very unique chance where we could actually deploy the AI in this mobile vans that could go out into the remote, vulnerable areas in Mumbai, like Dharavi or Worli for that matter, where you see they have been following this protocol, right? Where they did a mass screening of individuals, where if their vitals are found to be abnormal and their chest X is always also found to be abnormal, then they were sent for an institutional quarantine. Whereas if the chest X-ray showed slightly lower symptoms and their vitals also look, but the vitals look slightly challenging, then they were sent for home isolation. And if everything was fine, then they obviously have a normal. And this is something we did started off in the peak of COVID last year, and has been extremely successful. The fact that we have screened almost 30,000 individuals till date, right? That is a testament to the kind of scale at which healthcare is impacted. Using AI, because the challenge here in all these places in Mumbai and India also was that there was not a lot of RT-PCR cases, a lot of RT-PCR tests available. So in that kind of a setup, we could use AI to actually see which patients can be tested right now versus who can be tested 4 days later. So AI played a huge role in managing and monitoring patients during not only the normal healthcare challenges that we have like TB, but also during the most biggest devastating healthcare challenge we faced in the recent times. During COVID, also AI could suddenly, being an innovation, it could actually adapt itself to the COVID settings and actually proved out to be very helpful even for a government entity like Bombay Municipal Corporation. But then this is not just India, as I was mentioning. This COVID-19, we had a very big use case with the NHS trusts in UK. This was in Bolton, which is one of the higher COVID infected regions in UK, where the AI could actually do the similar task and actually help the clinicians there in monitoring the progression of admitted patients in the ICU, whether their lung condition is improving or deteriorating over a period of time. And we got a lot of awards just in UK for that fantastic deployment that we did with the NHS Bolton for COVID-19. Outside COVID-19, coming to other aspects of healthcare, the other aspect of healthcare is emergency care, right? Where you sort of need a patient, have a patient coming to a emergency ward, and then he needs an urgent care, right? And the challenge here has been always that most of the times, in most of the settings, there is not enough resources at the, in the critical hours, right? So specifically after, in the night, in the midnight, or some of those times in any part of the world, right? Not just India, UK, or some, but every part of the world you face that challenge, and in a slightly remote setting hospital. So that's why teleradiology solves that problem to a very good extent. But even within the teleradiology organizations, the challenge is they receive a lot of scans, right? And I'm talking about, this is UK's largest teleradiology company. It's called Medica. So they have been using, they face almost, I think, close to 5,000, 6,000 scans, critical scans on a daily basis. If that kind of a volume, you do not know which is actually way more critical than something that can be possibly looked at slightly, with a 1 hour or 2 hour delay. Because if it's a stroke patient who's coming in, right, they need to be acted within 20 to 30 minutes. You need to have a report out. In that kind of a setting, AI is playing a huge role in sort of identifying which patients can be reported right now. So they pick those cases and put up at the top of the work list. It also generates a very good initial report, which is just then signed off by the human reader and sent out, right? So this is something which is helpful in some of these critical places like stroke, right? Where every minute counts, every minute is a life saved. And using AI to save lives there's nothing that gets better than that, right? So it's just not only a regular identifying more diseases, but just in case of critical care, right? And this is not just in teleradiology. We are seeing this in multiple remote sites in India, in ambulances, everywhere there is something where, there's a critical role that needs to be played. AI is coming in handy. It's able to identify when patients, while the patient is in the ambulance, it's able to identify whether that patient needs a stroke care right then and there. So hospitals, teleradiology, ambulances, there's a lot of application which AI is able to bring. Now, outside that, this is an interesting story of immigration screening, where for immigration, a lot of chest X-rays get done, and this is with the Ministry of Health in UAE, where they have been using the X-rays. They're almost looking at close to 4,000 X-rays on a daily basis, and with a very limited bandwidth. So, in that kind of a setting, AI is super helpful in, again, picking out those normal chest X-rays so that you can just very quickly get those, immigrants screened and their medical fitness report issued very quickly, whereas the rest of the cases can sort of take their time, right? The cases that are abnormal. And this is the same case that is not just in, I think I've told you, in India, in UAE, but also in South Africa, where this is being done in this mobile vans. The mobile vans is a very interesting concept, where now you're not only doing what earlier healthcare used to be something where you used to go to a hospital and then you had all of this done at a hospital. But what we are seeing more and more in every part of the world, that healthcare is coming to your home, right? It's not anymore something you need to go out and do. But with this mobile vans, and this is not in South Africa, we're seeing this in every part of the world, that these vans go out in the community, they screen people. In South Africa, it's primarily TB. In UK, it's primarily around lung cancer. But a lot of these places where the vans are going out into Walmarts or this supermarkets areas, and then they primarily screen people for different diseases in the van. So you can just get onto the van. And again, the benefit is if you have an AI in there, if you figure out something's wrong with the patient, you can take an action on the patient right then and there. So that's the kind of impact which AI brings. And with some of these things being done on a mobile van, you can now go into a very remote area, let's say in Rajasthan, desert area, and you can actually do this at a scale, right? Which is something which has been missing in healthcare. While we talk about improvements at 20 years in healthcare, a lot of ideas tend to be around what more can you do with MRIs and what more advancements coming. A lot less is being talked about what you can do to actually improve healthcare for people who don't have access, don't have access to healthcare and to quality healthcare at a low price. This AI, and with some of this innovations like putting them into mobile van, mobile X-rays, taking it to remote locations, that's what is real impact, because that's when you're creating a lot of impact with very less means, right? So that's what in India we call as Jugaad. And that's a proven innovation that is driving healthcare as of today. And not just in South Africa, this is sort of happening in Philippines as well, similar projects with multiple mobile vans. almost 30,000 plus people screened in Philippines for tuberculosis and for lung cancer as well. So it's just not about infectious diseases, but lung cancer is obviously a big killer in lung cancer space. And you're doing so many X-rays every day. What is the chance that there is actually an incidental stage 1, stage 2 lung cancer patient out there which we are missing out? And research did show when we compared our AI against human reader, the AI detects lung cancer, incidental pulmonary nodules with 17% higher sensitivity. So there are those patients, stage 1, stage 2 patients who are getting missed out on a regular basis. Those are the kind of patients and those are the kind of impact that we are able to drive for lung cancer screening as well in multiple parts of the world. And just the last bit, so this is what we are doing in Latin America, but not only in Latin America, but in other parts of the world, is bringing innovation on analog X-rays, because what we see is that not digital X-rays are very rare commodity in most parts of the world. So innovations needs to happen where actually there's a need for innovation, and that's why we have been able to provide this tool that you see here on the side, which can actually look at an analog X-ray where you can take a photo and you can get a results within 20 seconds. So this is currently live in almost 17 plus Latin American countries where their physicians are using this app to detect all different findings from the X-ray just using this mobile app. And similar project in India as well, in very remote part in Samastipur district of Bihar, where this is being done for tuberculosis, where they're using the mobile app for screening analog X-rays. Almost 22% TB cases were picked up, which were missed by radiologists. So that's it. That's just a brief overview of what we have been doing so far and how possibly healthcare would look like in the next 20 years. With some of these things actually taking more common practice, I think healthcare is bound for a big improvement and a more equitable and more accessible change in the next 20 years. Thanks a lot.
Thank you, Rohit Ghosh. To watch the complete club meeting on this topic, visit the link in the description below. Subscribe to the channel to get instant access to all the podcasts. Follow us on social media through the links available in the description below. Thank you all for spending your time in listening to this week's podcast. Look out for a new episode every Wednesday, published on Google Podcasts, Spotify, and Apple Podcasts. If you're interested in hosting your podcast with us, fill the form available in the description below. Thank you once again. See you next time.